Take a few deep breaths and you feel relaxed. Deep breathing eases stress. It makes you feel good. It's actually a really nice habit to have because of the overall effect of breathing on our body. Now, imagine someone with asthma who actually has trouble breathing altogether. Asthma is a disease that affects your lungs. There's no cure for it, but it can be prevented and controlled. I'm Dr. Freddy Gomez, and today we'll talk about all you need to know about this chronic lung disease. Glad you could join us here on MedTalk Health Talk. Asthma is one of the most common lung diseases affecting more than 330 million people worldwide. Asthma is incurable, but manageable. We are joined today by Dr. Herbert Rosario. He's a pediatric pulmonologist from the Makati Medical Center, and we're also joined by Dr. Ronald Fajardo, an interventional pulmonologist at St. Luke's Medical Center. There are several symptoms of asthma, and they can range from being mild to severe. Among them is shortness of breath, the tightening of the chest, and while some people will experience chest pains. Now, in terms of breathing, someone having an asthma attack also starts wheezing. Sleeping can sometimes be a problem as well, while patients having trouble sleeping or even staying asleep because they have a hard time breathing. And in other cases, the constant coughing or wheezing keeps them up at night. Another symptom is the complications associated with coughing or wheezing due to a respiratory virus such as the cold or the flu. Now, my first question is para kay Doc Ronald. We want to explain to our audience why someone with asthma has a hard time breathing. Parang back to basics muna tayo.
People with asthma usually have a reaction towards what we call allergens. So what happens is yung airway or yung breathing ng isang tao ay sumisikip. Okay? Hindi lang siya sumisikip, nagkakaroon din ng exaggeration ng pag-produce ng tinatawag nating mucus o ng plema. Okay? Because of these two factors, yung pagsikip ng daanan ng hingahan at saka yung pagkaroon ng maraming mucus o ng plema, ito yung mga nararamdaman na sinasabi nating shortness of breath o yung hingal at saka yung sinasabi nilang may wheezing o yung may huni pagka humihinga sila. And the other one is yung pag-ubo-ubo.
Now, Doc Ronald, where is this wheezing coming from? How can that be eased? Kasi syempre, mabigat ang pakiramdam ng isang taong may asthma at nararamdaman niya ito at nahihirapan ang pasyenteng huminga.
Ang wheezing or yung huni na tinatawag natin ay nanggagaling dun sa yung pagsikip mismo ng daanan ng hingahan. When the air passes through yung tinatawag nating mga airways natin, ito yung nagkukos ng parang humuhuni or nagwi-whistle. Similar sa pag-whistle natin, yung pag-close natin ng bibig, nililitan natin yung yung sa ating bibig, ganun din sa pagliit din ng sa daanan ng hingahan, ito yung nagkukos o yung naririnig nating wheezing o huni.
All right, now let's talk about the science behind asthma. Doc Bistek, what happens sa lungs natin and pretty much the rest of the respiratory system kapag may asthma?
So your airways can swell and narrow and possibly produce more mucus. Okay, and this makes you breathe harder. Okay, so there are three characteristic airway changes that we see in asthmatic lungs. And number one is your inflammation. Okay, that makes your airways constrict and become smaller, okay, yung parang pumipito. Number two is your bronchospasm, wherein the muscles around your airways tighten. And finally, there is excess mucus, okay, and this will produce your airway obstruction. These three characteristics compromise your air exchange and then would give you difficulty of breathing, especially sa mga younger kids.
Now, I want to point out some factors that can trigger asthma, namely allergens, respiratory infections, exercise, weather conditions, air pollutants, and also stress. So marami talaga. This time of year, it's easy to catch a cold or the flu, bata man o patanda, which means if you're having an asthma attack, the combination of these problems could get worse. Now, Doc Bistek, is there any way that the viewers can avoid having to deal with these multiple problems?
Okay, so there are so many triggers, okay, for asthma, and they vary person to person. So the most common triggers Let me enumerate them. Number one is viral infection. Usually, yan ang nakikita natin sa mga kids. Number two would be your allergens. This would include your dust mites, your cockroaches, your pollens, your molds, your rodents, your pet dander. So bawal na bawal ang mga pets sa mga may asthma. Number three would be irritant, and this includes your smoke, any type of smoke coming from cigarette, coming from your car, air pollution, strong smells, strong fumes, strong odor, dust in the air. As you've mentioned, exercise and stress. Okay, there is a thing called exercise-induced asthma, and this can trigger your asthma. Medicines can also trigger asthma, plus weather changes, as you've mentioned, can trigger asthma.
And of course, air pollutants can affect your lungs because you're really taking in air that's bad for the body. Now, Doc Ronald, do masks work when it comes to trying to prevent these asthma symptoms?
So ang mask is like a double-edged sword for a person with asthma. So the mask can prevent the inhalation of the allergens such as the pollens, yung mga na-mention ni Doc Bistek kanina, the mga danders, mga pollens or mga dust mites, no, it can help prevent the inhalation of these allergens. However, yung sariling hininga ng isang pasyenteng with asthma, ito yun, nagkakaroon ng tinatawag nating humidity inside the mask. Okay, some person or some people are more sensitive to this type of humidity, and nagkakaroon din sila nagiging trigger din nila ng asthma ito. So for people who are only sensitive to the allergens or to the exposure, then the mask can really help or be protective to their to the exacerbation o yung mga triggers ng asthma. But to those who are sensitive to the changes in the temperature or changes in the humidity, it may cause further worsening of their asthma.
You're watching MedTalk Health Talk, and our topic for today is asthma. Still to come on the program, prevention and treatment of this chronic lung disease. Please stay with us. We are your partner in healthcare. This is MedTalk Health Talk right here on CNN Philippines. Asthma is a long-term disease of the lungs, and when a person is having an asthma attack, the airways leading to the lungs are inflamed and narrow. And because of that, a patient has trouble breathing. We are joined today by pediatric pulmonologist Dr. Herbert Rosario and interventional pulmonologist Dr. Ronald Fajardo. Now, what we want to talk about this time are the factors that can cause asthma. I'll start first with Dr. Ronald. There are several factors involved, but let's start first with genetics. Namamana ba ang asthma?
Asthma can be hereditary. So one thing that we usually ask among our patients is if the patient has parents or those who are close relatives who has asthma. Okay, so nakukuha ito through the gene. So if more family members have asthma, then there's a high likelihood that you will also have asthma.
That's very good advice. Now, pagdating naman sa lifestyle, meron din mga effects niyan. Dr. Ronald, what are some of these factors or what are some of these modifiable risk factors for asthma that our viewers should be aware about?
Okay, so you have to avoid exposure to these, okay? Especially exposure, of course, exposure also to tobacco smoke. Okay? You have to avoid places where people usually are smoking. Also, another thing, is the stress. You have to also lessen your exposure to stress, especially at work.
That's a good point, Dr. Ronald, that you mentioned stress. Paano nakakapag-induce ng asthma ang high stress level?
If you are stressed, you breathe faster or you breathe heavily. Okay, so this modifies the humidity or the temperature within your airways.
Okay. Now, there are steps that one can take in order to prevent and control asthma. That's going to be the focus of our next discussion at this point. And it's also a conversation you need to be having with your doctor. Now, first things first, understand the triggers. It's also good to take down notes on trends. And it's almost like retracing your steps in order to gain more information. Is this right, Doc Bistek?
There are certain steps that we have to follow in order to manage properly your asthma. And number one would be patient education. Okay, so the patient should be aware what asthma is, avoidance of the triggers, what meds to use, and what not to use. Okay, and specifically, what I tell my patients is they have to have an action plan, an asthma action plan. It is a written document that they can just write at home, and then there are certain steps that they can follow if they have an asthma attack or not.
Now, aside from knowing when an asthma attack can happen, it's also paying close attention to what can make it worse. Now, Dr. Ronald, as soon as an asthma attack happens, what should be done?
Okay, so you have to see first how severe the asthma attack is. We have several stages of asthma attack. We have this mild, moderate, and severe asthma. Okay, so for the mild and moderate type of asthma attack, wherein the patient can still speak in sentences, or yung tinatawag nating respiratory rate is still less than 30. Okay, and there is no use of what we call the accessory muscles of respiration, then we can do with yung mga tinatawag nating relievers, yung mga beta agonist, yung mga inhalers natin or the nebulizations. However, if the patient is talking already in phrases, putol-putol yung kanyang pagsasalita, yung respiratory rate is more than 30 in 1 minute, or hingal na hingal siya, tinatawag nating may use ng accessory muscles, we can already see yung mga muscles niya dito sa chest or even the abdomen is already rising, then that patient needs to seek immediate medical attention and go to the emergency room.
Now, for people with asthma, medication needs to be followed properly. Now, Doc Bistek, what types of medications are given to treat asthma or maintain asthma at a controllable level? What exactly do these medicines do for them?
Well, usually, again, treatment of asthma, your goal is your basic goal should be to have a risk reduction, and number two is your symptom control. And this would involve you to properly assessment, adjusting your treatment, and then reviewing the response of the treatment, of the medicines that you give to your patient. Usually, it requires a certain pharmacological therapy determined by the degree of severity or the degree of asthma control.
Itong mga inhalers and nebulizers, how are they used in combinations with oral medications? At pwede rin ba ito sa mga batang na-diagnosed with asthma?
Yes, definitely. So usually we recommend using your inhalers even for young kids.
A lot of viewers may be wondering, are there any over-the-counter medications that they can buy in order to treat asthma?
There are only limited choices. For symptomatic relief lang dapat ang mga over-the-counter, such as if you have excessive coughing, you can buy over-the-counter antitussives or medications to stop the coughing. But specifically, the medications to relieve the symptoms, yung paninikip ng dibdib or yung paghirap ng paghinga, you need a doctor's prescription for that, and you need to consult a doctor. So it is also very dangerous to self-medicate, especially if you have asthma, because you don't know how severe your asthma attack is and when do you need to already be admitted. So I do recommend that all patients who has asthma have regular checkup with their pulmonologist or their attending doctors.
We're together in Health on MedTalk Health Talk. When we return, we'll talk about breathing exercises that can help relieve asthma. Stay with us. Welcome back to the show. MedTalk Health Talk is your connection to healthcare. I'm Dr. Freddy Gomez. Now, there are different types or classifications of asthma depending on how often they happen to someone and how badly the symptoms are. Dr. Ronald, can you please explain these different types of asthma and at what point is medication needed?
There are times that we call mild lang yung asthma mo, okay? So these are those who have only have asthma attacks during exposure to certain allergens, but also those who have what we call intermittent or yung mild persistent, no? This is the types of asthma na they're only they need what we call only the rescue medications or yung mga meter dose inhalers or just the nebulizers. However, there are patients who have moderate persistent asthma who have need a higher dose of medication or who needs maintenance medication such as inhaled corticosteroids. But these are also delivered through inhalers or even nebulizers.
Now, Doc Ronald, a follow-up question. Is there any first aid treatment for someone with asthma? Let's say someone is visually having an asthma attack. What should someone next to them or their loved ones do as first aid?
Just a mild asthma attack, as I've said earlier, no, if the respiratory rate is less than 30 or is not having a use of what we call accessory muscles of respiration, hindi pa gumagalaw yung tiyan or hindi siya gumagamit ng mga muscles doon sa leeg, then they can do what we call first aid with the use of beta agonist, no, yung medications na such as the salbutamol or yung with apratropium with combination of salbutamol na mga inhalers and nebulization. However, pagka severe type of attack, okay, yung hingal na hingal yung patient, they can use this rescue medications, the nebulization as well as the inhalers every 15 minutes, no, while waiting, no, while planning how to bring the patient to the emergency room or into the hospital.
Now, recent studies have also shown that breathing exercises can help relieve asthma symptoms. Doc Bistek, could you elaborate on this more?
Yes, it's very effective. You have to know your proper breathing. So another thing is anxiety can trigger. So you have to be relaxed every time. You have this feeling that your lungs are getting, or your airways are getting tightened.
Okay, very good. Dr. Fajardo, same question. Is there anything else our viewers would be able to learn or some tips when it comes to maintaining that health in order to somehow minimize the symptoms of asthma?
Okay. Patients with the severe asthma, especially those who are already in their the elderly, they become afraid to move around. Okay, so they undergo what we call a deconditioning syndrome. Okay, so ang nangyayari, the muscles become atrophied or lumiliit yung mga muscles, and the activities of daily living is very affected. Tapos nun, their difficulty of breathing or their dyspnea is worsened because they don't move, so they don't do exercise. So for the adults, we have what we call yung pulmonary rehab, wherein they do exercises of the muscles which involve the breathing or those that involve those in the upper part of the body. Okay, so yung mga kailangan itaas yung mga lagi yung kanyang mga kamay or yung mga activities ng katulad ng pagpapaligo, no, or taking a bath for themselves, or even pagtaas ng spoon going to pagsubo. Okay, so for those with severe asthma, okay, they undergo tinatawag namin deconditioning, so they need to have exercises that are focused to the upper part of the body.
And with that, we'd like to thank our guests for joining us on the show today, pediatric pulmonologist Dr. Herbert Rosario and interventional pulmonologist Dr. Ronald Fajardo. We learned a lot about asthma today. This is an incurable chronic lung disease that can be managed, prevented, and treated as well. Maraming salamat. We're glad you could join us on the program. Stay safe, everyone. I'm Dr. Freddy Gomez.